Now I am handling the session to Dr. Moin Bubere from India. So he will be the chair for this session, Arabic medicine and hijama cupping therapy. Thank you.
Thank you very much, Sachin. I appoint Dr. Shariq Ali Khan as my co-chairperson. Please come. Good afternoon. So you all are welcome to the Beijing, China again at the Hotel DoubleTree by Hilton. As the track's name, Arabic medicine and hijama cupping. This is the new track to the OMICS groups, and lot of nice presentation was there, but unfortunately the speaker from Indonesia, they didn't came. We put some problem with them. So no problem, we are having the three speakers here in this track now. One on from my side on hijama cupping. Second one on from my colleagues Dr. Shariq Ali Khan on Fasad. And third one on by my colleague Arman Agwani from Jaipur, India on the spiritual diagnosis of the diseases. So my lecture first is on the hijama cupping from India. The second one lecture was there by Suryani Hidayatullah, the benefit of hijama wet cupping for children health fever phobia. Third lecture will be on the effect of hijama wet cupping on increased number of cell macrophages as the immune system by Dr. Wahidatul Vidara. The fourth lecture will be on al-hijama cupping therapy in Islamic prescriptions by Hakim Sayyid Shah Anisuddin. The fifth lecture will be on the benefit of hijama to remove the negative effects of the vaccine by Devi Histavati SH. The sixth lecture will be on the safety, efficiency and mechanism of action of Fasad, bloodletting through venesection in the cases of osteoarthritis, a controlled clinical study. Very nice lecture by Dr. Shariq Ali Khan from Aligarh. The eighth lecture will be on the Kathur Suthadi on anatomical explanation of Ummul Mughith, prophetic blood cupping site for the central nervous system diseases. The ninth lecture will be on Muhammad Karyatu SWOT analysis weight cupping development in Indonesia. And the last lecture from the Arman Agwani on diagnosis of spiritual illness. So I'm just giving very thankful to the OMICS group to start this new track on Arabic medicine and hijama cupping, and also I'm just talking with them to do a very nice conference in Mumbai. Most probably will soon invite you all to the Mumbai for the big conference, first conference on the Islamic medicine and Arabic medicines. And also thankful to this hotel Hilton is very nice. This atmosphere is there and very nice. They are giving the services to us. And again, the last but not the least, so the people of China to invite us here in DoubleTree by Hilton to give this nice conference. So I just start my track now with my speech. Introduction देंगे.
So Bismillahirrahmanirrahim. This is the post-copy session, and Dr. Moin Bubere from India, a renowned physician from India on cupping, is going to deliver his lecture. His biography at a glance is: Moin Bubere, born in 1972, has done BUMS in 1994, MD Unani in 1999, and PhD Islamic Medicine in 2004. Awarded as Best Doctor of India, Best Young Doctor of India, vast clinic in many appreciations, founder of Al-Ahad Clinic in 1995, Islamic Institute of Dawa in Dua in 1997, and many followed the pipeline. Delivered 22 national and 8 international seminar and conferences, speeches, and attended many conferences around the world. Presented 414 research papers. He has publication also to his contribution, which include Mano Salwa, Islamic Way of Life, Hijama Cupping, the World West Medicine, and others. So I request Dr. Moin Bubere to please start his lecture.
Thank you very much. First of all, I'm just, this is Arabic medicine lectures, so I'm just telling to all you of Assalamu alaikum wa rahmatullahi wa barakatuh. This is Islamic greeting to all. You all are blessed by the Allah, inshallah. So we are starting these lectures, Hijama cupping therapy. The future of detoxification therapy. The main purpose of the hijama cupping is detoxification of the body. Means before giving the medicine, we have to eradicate the disease first from the body. Then we can exchange the body to fight the disease. That is the main purpose of the hijama cupping therapy. So you learn on these lectures all this thing in briefly, because time is very less. Hijama's topic is very high, but I'm just going superficially to all the topic. I want to cover not the whole topic in this lecture, but I will try to cover nice thing in these lectures. So I'm Dr. Moin Bubere from Al Hijama Cupping Cure Centers, B1D Mumbai area. It is in India. So just I want to just elaborate this thing. What is hijama cupping? A lot of people know about the hijama, but people still want to know what is the hijama. So hijama is nothing but a revolution. It was a forgotten therapy from Prophet Muhammad sallallahu alaihi wasallam. It was practiced in the Asian areas of Arabs and a lot of areas of Chinese. Still Chinese are doing the cupping, but they are doing only dry cupping. We just discussed later on what is the Chinese cupping, what is the Arabic cupping very shortly. So what is hijama cupping? Hijama cupping is nothing but how to do hijama works. In hijama, we collect all the toxin and bag material of the body in cups. This is the cups. Okay? We just accumulate all the toxin and bad material of the body in this cup, and after making the scar, we detoxificate out from the body. Hijama in Arabic means sucking. It is the Arabic name in the traditional medicine for the wet cupping, where blood is drawn by the vacuum from a small skin incision for the therapeutic purpose. It is reported that the Prophet Muhammad says, indeed the best medicine you have is hijama. If there is any best medicine or expensive medicine you use, it is hijama cupping. Meaning of the word hijama. Hijama is from Arabic word hajam, means weight. In hijama therapy, we detoxificate the body and reduce the toxin weight of the organ or affected parts. Mode of action of hijama. In hijama, we put the cuffs on the vital organs of the body and affected organ of the body to detoxificate it out fully in a single sitting. Main aim of the hijama is detoxification of the body. Not only the accumulated blood removed, but also nerve stimulation is there, local blockage clearation, and attention of the body towards the affected part is established. What is the main aim of the hijama cupping? You have to make in mind is detoxification. Procedure, very simple procedure. Hijama can be performed almost anywhere on the body, often on the side of ache or pain in order to erase it out. We just putting the cup on the below the neck and on the scapula and on the dorsal side of the thoracic. We can put the cup on the heads, for the head problems or any mental problems. Or baldness also, we just put the cups on the heads. For acne, we are putting the cup on the chin. It's a very nice result with only 1 or 2 sittings. You can erase acne without medicines. Directly target organs. We are just giving the target organ therapy to the acne, and unbelievable results is there. We can also put the cups on heads for the mental distribution on the second photos. For sexual incompetency, we are putting the cups near the sexual organs areas. For the fourth photos is for, you just see the one lump or tumor nearby the neck. We just detoxificate it out, and this patient is cured within 4 sittings without any medicine. On the fifth photograph, you feel it is for the thyroid patient. We just putting the cup on the chin, below chin. For the arthritis patient, we are putting the cups on the knee, near or knee. For any lumbar spondylosis or any vertebral column dysfunction, we are putting the cups on the back of the patient. This is patient for the any type of addiction. If you have any patient of having the addiction, we are putting the cup on the heads. It's a very nice point of eye boosting. With this point, you can boost your eye in 1 or 4 sessions. It depends on the number of your eye. This is on chin for tobacco chewing, tobacco ulcer or mouth ulcer patients. This is for sciatica. We are keeping the cups. This is for the mental distribution patient. We are putting the cups on head. Method of the hijama cupping. The location is first shave. If necessary to ensure a tight seal with the cup. The mouth of the cup, metal, glass, or plastic cups are generally used. Although traditional horn were used. It's placed on the skin at the site chosen for the hijama. Then a tight seal is created. The traditional medicine method is to burn a small piece of paper or cotton inside the vessel so that the mouth of the cut cling to the skin. Some practitioners now use a machine instead of the manual cups. Some practitioners still strictly adhere to the prophetic medicine with the use of the fire, both for the sterility and the benefit of the properties for the element of the fire itself. That may be present. The cup is left to the clean to the skin for the few minutes, then it is left off, and several very small incisions are made in the skin. The cup is then put back as it was before until the flow of the blood subsides. Hijama is considered as a form of energetic medicine because it has been claimed to be unclaimed the meridian in the body, and we view by some practitioners as a cure that will available by black magic and possession also. History of hijama cupping. The oldest record of the hijama cupping is in Everest papyrus on 3000 BC. Oldest book on the cupping is on 1550 BC by Egyptian. China started cupping in 1000 BC, and Greece Hippocratic is in 400 BC. Islamic cupping hijama started in 580 when our Prophet came. What is different between Islamic or this Arabic cupping and Chinese cupping? China are doing the dry cupping, and Arabic hijama cupping is always wet. This Chinese meridian is useful in Arabic cupping. Chinese meridian are different. In Arabic medicine, Arabic cupping, they are using the sunnah points. Means Prophet says the sunnah point is a 13 in the body, 3 on the heads, 1 on the neck, back of the neck, and 2 on the scapula, 2 on the buttocks, 2 on a knee, and 2 on the elbow. In Arabic hijama cupping, they are also following the sunnah dates. I mean, our prophet says on 17, 19 and 21st of the month is better for the cupping. What is the benefit of Sunnah point? We can detox whole body with the Sunnah points. It's a very nice result with these Sunnah points. Types of cupping: dry cupping and wet cuppings. Dry cupping, we are just putting the cups and for 10 minutes and just remove the cups. This is the cups. Here is a plastic cup we are using. Before it was they are using this coconut, half a piece of the coconut, this thing, and they are putting the oil inside cups, and after they are doing the fire, and they are putting this thing on the body. After 10 minutes they remove it out, and the main purpose of this thing to make a negative pressure inside. So it's a very nice thing we can do with this plastic cup, and we just put this cup any part of the body, and with this vacuum pump we can make the vacuum. After 10 minutes we can remove this thing with this clinking, and again after 10 minutes we just put some scar on the body, and again we put the cup here, and we do this suction with that vacuum pump. Again all the blood will come inside these cups, and just we throw it out from the body. The part where we keep this thing, that is supposed to get out. So this is the wet cupping. First I put the cups, then I did the scar on the body. It's very superficial scar with the surgical blade in aseptic precautions. We are doing it out, and after this collection of this bad material from the body, the affected organ will be totally cured. The types of new cups are coming now with the way dry, fire, oily, and many more are coming. Dr. Tomar classification of cupping therapy. Technical types, there are dry cupping, wet cupping, massage cupping, and the flush cupping. Power of suction, light, middle, and strong. Method of suction related types is fire cupping, manual cupping, and electric cupping. Method inside the cup related with herbal, water, sometimes is a needle, and sometimes magnet also. Different cupping instrument is before time, now time, which sophisticated instruments are coming with the cups, glass cups, and some silicone cup is also coming, disposable cups is also coming. This is the now very common cups I show to you out, and there are 5 or 6 another number from small to big. It depend on the size of the body of the patient or type of the organ. We are just putting the cups. These are blades 6, 10, 11. It depends on the side we are using it out. Most probably we are using the surgical 11 number blade to do the surgical procedure. This is the add-on of the cups. We are using gloves, we are using face masks, we are using gauze and apron also. After cuts and after cleaning, we are using the betadine ointments for the cleaning, and one tetanus toxoid injection for the body. This is a 2 type of gun, selection of gun. Hydraulic gun is there now, and this is the manual gun. This is the cupping chair, and this is collecting vessels, and this is a shaver. If there are the hair, we can shave the patient. These are new instruments are coming with the cupping therapy. Just like to tele cupping is also coming. These white instruments there with the tele cupping. We can do the tele cupping with the internet, and just put the cup, and you can do anywhere in the world from your clinic. Main aim of the cupping is the detoxification of the body. Benefit of hijama cupping preparation does not before or after hijama. You just clean this thing, the part where you want to put the cups. There is no age factor. If there is a small age, you can put the small cups. If there is anemic patient, you just take care of this patient. If patient is with heart diseases or patient with the diabetic diseases, you can take care of the patient. Difference between the cupping, leaching, facade, and blood donation. I'm just showing you the cupping, hijama. We are just putting the cup on the target organ and just detoxification out from the body. In leaching, we are cooking. We are just putting the leech on the same part of the body, but it's only from the one point of the body. In hijama cupping, we are doing with the 60 or 70 cuts in the one cups. Okay, this is sucking from only one point of the body. Hijama cupping in same part we are doing from 50 to 60 cuts in the cups. Facade means we are just directly open up the vessels. A blood donation is also from the vessels. Is difference. What a scar told to you. If you get the scar with the healthy, this is the first scar with the healthy blood circulation. Second scar is the moderate strangulation circulation. Third scar with the severe strangulation is there inside the. Fourth scar is for the congestion and the toxin. Fifth scar is for purpura. Seventh scar is the blister. Maybe possible some, if you do more time, more than 10 minutes cupping, blister will come to the body. The blister, this is the black patches, blood and the oil differentiation is there. Scar management is very, very important in the cupping. If you do the scar to the diabetic patient, you have to manage it out very nicely. So please take care. Ask the patient if he is in diabetes. You ask him daily for the scar management. What are the single detox and what is the multiple detox? It's a very nice thing. If you want to do the detoxification of the body, one cup cannot detox your whole body. You have to do the multiple detoxification point on your body. So for this thing, we just select some point on the body to cure the disease of whatever organ detox this thing. Is hijama cupping treating all disease? Maybe possible. Hijama cupping is treating all diseases. Lot of diseases are covered in the hijama cupping. I will show you my clinical study. Worldwide, the cupping is now expansion. Lot of people from the sport and this thing, they are doing the cupping. Case study by me in the IIDD and 5cc. This is my council of cupping and cauterization cure center in Mumbai. And second is Islamic Institute of Dawa and Dua. It is also in Mumbai. And we are doing the research on this hijama cupping. Principle of hijama cupping is to with the detoxification of the body. New concept is coming in the hijama cupping therapy now. So we are having the VOD and TOD. VOD means vital organ detox. If patient is suffering from arthritis, we have to first go for the vital organ detox. We just put one cup on the spinal cord, second cup on the heart, third cup on the lungs, fourth cup on the liver, fifth cup on stomach, and 2 more cups on the both kidney. To detoxification of the body, this is the vital organ detox. And target organ detox means if you are having the arthritis, you also put the cup on the arthritis affected parts and detox that part also. The main purpose of the study is to prove the hijama cupping, VOD and TOD points detox whole body and make it toxin free and cure all the major complicated illness. Method: more than 90 kind of diseases or symptoms were treated by the cupping therapy. According to the included study, the top 20 disease conditions in which cupping is commonly employed were 300 study by pain, herpes zoster 91 study, cough and asthma 70 study, acne 92 study, common cold 210 study, urticaria 81 study, rattle femoral neuritis with 61 study, facial paralysis with 13 study, cervical spondylosis with 90 study, lumbar spine with the 19 study, scapular peroneal arthritis with 17 study, baldness with 102 study, headache with 13 study, soft tissue injury with 10 study, myofasciitis with 10 study, 264 study were concerned on other diseases treated by the cupping therapy. The main results are, we found in all illness cupping have tremendous results. Conclusion: Cupping has tendency to cure all the major illnesses which are still untreatable with the modern medicines. Overall results: all type of pain gone after cupping therapy, toothache, cancer ache, abdominal pain, menstrual pain, extra in one session only. Varicose vein in 3 sessions. Slip disc vertebral dislocation in 4 sessions. High cholesterol in 2 sessions. High sugar level, high uric acid, serum bilirubin in 3 sessions. Cancer pain patient did not need morphine after cuffing. Brain hemorrhage, cardiac diseases and all lung diseases need 4 sessions to cure. Thyroid, both hypo or hypothyroidism, needs 3 sessions to cure. Injection abscess drain without pain in 1 session with cupping therapy. Tennis elbow treated fully with cupping therapy. Psoriasis, eczema and other skin lesions need 4 sessions. Frozen shoulder, cervical spondylosis, lumbar spondylosis, hemiplegia need 4 sessions. Alopecia in 4 sessions. Leukoderma in 4 sessions. Acne in 4 sessions. Allergic rhinitis in 4 sessions. Sinusitis and nasal polyp in 4 sessions. Eyesight boosting in 4 sessions. We are just putting the cup on near to this eye, and very nice result with the first or 2 sessions started. Mental retardation, BP, sugar, concentration loss, tension, thyroid, humoral disbalance, gout, arthritis and other untreatable ailments fully treated with the hijama in 4 sessions only. Conclusion for our consumer is this: you cannot got all this benefit in a single medicine or therapy. So why not my word prove this nicely? Hijama cupping is the future of detoxification therapy. Thank you very much.
So the paper is open for discussion. Any question, please?
Chinese use the bamboo.
Yeah, of course.
In my country, very common. Very common.
If you want to see the hijama session, I can explain on this screen also. We do it out on this screen.
Yes, perhaps because people from your country and from immigrants brought to my country.
Yeah.
The cupping is very common, mostly in our grandparents. They always use the cupping in our country also. And well, the Chinese, the tendinomuscular meridians, they're very superficial in traditional Chinese medicine. Is almost at a skin level. So people said, what is, for example, the fundamental, the traditional Chinese medicine of this use? Because the tendinomuscular channels are very superficial, and you can reach it with very easily with the cupping. So I agree with you. It's very good treatment. Yes.
If you want to see, we can do a demonstration here on the physical demonstration or video demonstration. We can. I will show one cupping demonstration. I'm just putting the cup on the head.
What's the case?
It's a case of high BP patient with high cholesterol. After 10 minutes, I just remove the cups and start cutting with the surgical blade. It's very superficial. It's very superficial, no pain at all.
Why don't you make honey?
Honey?
Yes, honey in cupping syrup. Make honey.
Yeah, we put oil first. Because if you don't put the oil before this cupping therapy, there is no oozing. Means if there is ooze, no, it's not correct in the it's not correct in the cups. It will only there only. Okay, we just put the first oil there, and we put the cups there. Then after that we do the cutting. So all the oozing material will come in collect in these cups. I will show. Just
Application of
no local anesthesia needed. No local anesthesia needed.
How is it possible?
Yeah, of course. I will tell you. After sucking for 10 minutes, the part is slightly anesthetized. Okay. So there is no pain. So after 10 minutes, just see what is coming out. This is the detoxification of the body. This is a target organ therapy. There is no pain at all. There is no pain. And see, there is no bleed at all after the cleaning. There is no bleed. So within 2 or 3 sessions, BP, cholesterol will eradicate out from your body. There is no need of medicine after hijama cupping therapy. This is the best way, best detoxification therapy of traditional medicines.
You know, in the sciatica, it's indicated to make a puncture from the venous.
Did you apply anything in the cup?
No. We are just putting the oil first. Okay.
Which oil?
Yeah, it's coconut oil, olive oil, no problem. We just want the lubrications. Okay.
So you are just creating a negative pressure there.
Yeah, of course. This is the cups. Okay. This is the cup. We are just putting the cup on any part of the body. Can anyone come, please? Yeah, please. Thank you.
It's a negative pressure.
पीछे लगा देते हैं ना?
पीठ पे
हाँ, पीठ पे।
निकालना पड़ेगा।
नहीं तो वो ऊपर लगाओ सर, हाथ में लगा दीजिए। इधर। हाँ। कुछ नहीं होगा।
थोड़ा सा नीचे जाओ। गर्दन छोड़। आप इधर आओ। आपकी गर्दन बड़ी। इनके इधर आओ।
ये चेयर पे बिठाओ ना, चेयर पे।
Please. Just remove your cups. पीछे लगाना सही है। गर्दन बताओ। Please come here. Please. All of you. Please, sir. Just see. So hold it. Just you can do it. Just see. Just wait. I will tell you. Please apply it.
Just like that.
Pull on it. Button, please open the button. Do the suction.
lose the shirt, please.
Lose the shirt.
Section.
Yeah, do the suction. Suction. I will show. 1, 2, 3. That's all. And then after 10 minutes, we just remove it out. And these did the cuttings.
Surgery.
Same time we are going to put the cups. Okay, you can do it. Please open it.
Someone.
No. Okay, full point to Mr. Tariq.
Here go. Oh, good, yeah.
So what do you need? What do you need? Full lifetime this medicine or one-time detox? Which one is better?
Of course, if it is working.
Is
then it's better.
very well. If you want to see, we are having a lot of 2,500 clips are there, but in all in this Hindi language, English language. You will see. You
क्या
can
कोई
see.
specific site होता है जहाँ आप लगाते हैं?
Yeah, there are.
हाँ, स्पेशल साइड ऐसा होता है, देखिए मैं बता रहा हूँ। एक कप जो हम लोग यहाँ लगाते हैं, इसकी लगाने की वजह से ये होता है
You
कि
can explain in English because these
Okay,
people,
no
they are
problem.
not
We are just putting one cup on the spinal cord, okay? Second one on the heart, okay? Third one on the lungs, fifth one on the liver, fifth one is on the on the this stomach and both kidney, okay? The 7 point are the very nice for the detoxification of the body. Yeah, all the water organ detox. This is the VOD, vital organ detox, okay? After that, we just put the cups on the target organ. If you're having the pain in the knee, if you're having the pain in the back, if you're having the pain in the hand, we can put the neck cup on that also, okay? So first, we vital organ detox, then the target organ detox. Thank you. Any more questions? Just wait. One demonstration. एक class. Maybe possible. It's probably for the if in the Urdu language. No problem. Patient with. Now, okay, you can see it here. The patient with the knee pain. Okay. The patient with the knee pain is having the pain with the last 4 years. In one session, he started bending his leg. Okay. From 4 years, he was having this pain. Okay. In one session, he started bending the legs. Yeah, because of that we are Indian, no? These are local people. देखिए क्या बोल रहे हैं, पहले लेटरिन में मैं ऐसा बैठता था और अब जो है जब से कल से कपिंग किया मैंने तो मैं ऐसा बैठने लग गया. Okay, from last 4 years he is sit latrine like this. Okay. कल रात से कपिंग कराया, कल से इसको आराम हो गया, कल से उसने विदाउट मेडिसिन स्टार्ट बैंडिंग हिज लेग. ओके. Any other questions? Yeah, please.
Yeah, thank you, Doctor, for introducing this methodology of Sunnah.
Yeah, of
I
course.
believe it actually, but usually to convince the scientific committee,
Yeah.
you have to have an evidence. For example, if you link such as cases with research to prove.
Yeah, of course. We are
what is difference?
Okay. Okay. No. We are collecting the sample before and after treatment. We are having the evidence of this thing before cholesterol level, after cholesterol level, before uric acid level.
Exactly.
Lot of difference. You can't bleed it out within 4 sessions. 1200, 1100 cholesterol cupping come to the 200, 230. It's a very nice thing. Creatinine level down from the 12 to 4, 5. This thing within 1 or 2 sessions. Very nice, no?
So have you publication?
Yeah, of course, we are having the publication. Unfortunately, I was just giving this introduction to the hijama cupping therapy. Next time I will do with the publication in specific disease. I just come here for the giving the main thing to give the introduction to the track Arabic medicine and hijama cupping therapy. I just give the full description of this hijama therapy, and maybe possible hijama will rule the world very soonly. It's very is a population of all the world with fire, and in China they are also doing the cupping, but they are doing with only dry cupping. The difference between the dry cupping and wet cupping you can eliminate out if you put the cups in on the some part of the body, and if we didn't do the cuts. So it's a half procedure, it's not full procedure. We have to detoxificate out that wrong material from the body. That is the main procedure, and then there is for the it will get a nice result for the whole life. Okay? Any more? Yeah.
My father explained to the daily life, and my experience is that if the cupping continue for more than 50 minutes, maybe there may bubbles. There will.
Yeah. Before it was by bamboos. Yeah. Before it was by a fire cupping, bamboo cupping was there in China. Yeah, of course.
Yes. My question is, what should I do? Should I puncture the bubble and let the pus flow away, or let the body dissolve the bubble?
Okay.
Should I puncture it?
Yeah, you have to puncture it out. Yeah, of course. If you want to do the full procedure, you have to puncture it out, and just means you have to detoxification that parts. Okay. The main purpose of the hijama cupping is the detoxification of that parts. Okay. If you just put a bamboo on that part, okay, no problem. Pain will go for some days, but it again came. Okay, again come. If you want to do permanent relief, you have to detoxification out that body, the material, bad material from your body. That is a nice for the nice result. Okay. So you go for cutting and you will get a nice result for long-lasting results.
I think that the question is, because many times in traditional Chinese medicine, first they make the one for getting out, and you make like in 2 stages. First you put the cap, then you make the scarf,
Yes.
and then you put again the
Yeah,
cap.
of course.
And I think that is very good.
Yeah, of course.
Yes.
Yeah, of course. We have to duplicate out that from the
Easy.
bad material from the
You have
body,
no
yeah, of
pain
course.
in the second cap, between the 2 cappings, you have no pain
Yeah, of
when you
course.
have the cap.
Some people are also doing with the fire cupping this thing. There is no use of fire. We have to make the vacuum. Sometimes this fire will touch your skin. It will burn your skin. Okay? You have to make the vacuum first. That's nice. Okay? The main purpose of this hijama cupping to make the vacuum. The vacuum come.
I don't speak.
Yeah, no problem.
قال رسول الله I can speak English.
Okay.
قال رسول الله صلى الله عليه وسلم شفاء أمتي في 3: شربة عسل وشربة محجم.
Yeah, of course.
والكي وأنا أنه متى الكي.
Yeah, of course.
شربة محجم تعادل الوكس.
And it's telling like this, there is a cure in the 3 things. Okay? Prophet Muhammad Sallallahu Alaihi Wasallam said there is cure in the 3 things. Honey, skip of the honey, hijama cupping, and the cauterization. But I forbid the Ummah from doing the cauterization. Things like that. Okay?
Because it is painful to the body and
Anyone? Thank you very much. So you still on to the hijama cupping as the main purpose and for the documentation of the product. Thank you very much.
Bubere, sorry.